All right, let's talk about a revolution in medicine. And I'm not talking about some new pill or a shot. I'm talking about something that lives right on your phone. This is the world of digital therapeutics.
Think about this for a second. What if your next prescription wasn't a pill, but an app? I know, it sounds a little bit like science fiction, right? But it's not. It's happening right now. So we're going to dig into how software is literally becoming medicine and what that's going to mean for, well, for all of us. Okay, to really get this, we have to understand the why. And the why is pretty serious. Our healthcare systems, they're strained. They're being pushed to the breaking point by the huge rise in chronic diseases. Things like diabetes, heart conditions, mental health issues, these aren't one-and-done problems. They need constant management, and that's something a doctor's visit every few months just can't handle. We've hit a wall, and that's exactly why we need a totally new way of thinking. And that's where digital therapeutics, or DTX for short, come into the picture. Now, I need to be super clear about this. We are not talking about your everyday wellness app or a fitness tracker. No, these are different. DTX are actual software-based treatments that have been clinically validated, and this is the key part. They are prescribed by a doctor to treat a specific medical condition.
So the big question is, how does this prescription in your pocket actually work? And maybe more importantly, what makes it so different from the thousands of other health apps you can download right now? Well, it all boils down to two words: validation and regulation. Think about it. A wellness app, it might track your steps, maybe guide you through a meditation. That's great. But a DTEX app, it's on a whole other level. It's gone through the same kind of tough clinical trials that a new drug would, all to prove that it has a real, measurable, positive impact on a specific medical condition. It's the difference between getting some helpful advice and getting an actual prescription.
This whole thing didn't just pop up overnight. It's been building for a while. That first FDA approval back in 2017, that was a huge deal, a real landmark. Then, of course, the pandemic hit, and suddenly the need for remote healthcare just exploded. And now we're seeing the big players, insurance companies, even national health systems starting to cover these treatments. That's a massive signal that this is moving from the fringe right into the mainstream. And when things go mainstream, well, the money follows. Let's look at the numbers, because this shift has created an absolutely exploding market. So just looking out to 2026, the global market for these digital treatments is expected to hit over $12 billion. I mean, that's already a huge industry by any standard. But wait, it gets crazier. By 2031, it's projected to more than triple that, hitting over $38 billion. That kind of growth, it's just staggering. It really is. I mean, look at this trajectory. We're talking about a compound annual growth rate of over 25%. In the world of established healthcare, that is almost unheard of. It's a huge challenge to the old-school pharmaceutical model, the one built on physical pills. This is built on software that can be updated and improved constantly. So what's behind this massive boom? Well, it's pretty much a perfect storm. You've got the growing need because of all these chronic diseases. You've got the tech, powerful smartphones, fast networks to actually make it work. You got a ton of investment money pouring in. And this is the big one. Insurers are finally starting to pay for it. Then you throw in AI that can personalize everything. Yeah, that's a recipe for a total transformation. Okay, but let's get down to it. How can a piece of code, an app on your phone, actually change your behavior, your biology, even your mind? Let's peel back the layers and look at how this stuff actually works. All right, this is where it gets really cool. The secret sauce in a lot of modern DTEX is something called agentic AI. Now, this isn't just some simple pre-programmed script. No way. This is an AI that's actively sensing what's going on with your body in real time, through your smartwatch or phone, and then it decides all on its own what kind of help you need in that exact moment. It works in this amazing continuous cycle, what they call a closed-loop system. So, step 1, the app senses your data, maybe your heart rate spikes. Step 2, the AI analyzes that and goes, that looks like a sign of stress. Step 3, it intervenes, maybe by suggesting a quick breathing exercise. And finally, step 4, your body adjusts. And the best part, this whole system is constantly learning and getting smarter about you. And on the psychological side, these apps are really clever. They come at the problem from two different directions at once. First, there's the top-down approach. This uses proven therapy techniques like cognitive behavioral therapy, or CBT, to help you rewire your thinking patterns. But then there's the bottom-up approach, which is all about gamification. Think points, rewards, progress bars, All that stuff that taps into our brain's reward circuits to keep us coming back and staying engaged with the treatment. It's a really powerful one-two punch.
Okay, so this all sounds pretty incredible, right? A game changer. But like with any powerful new technology, you've got to look at both sides of the coin. There's the promise, and there's the peril. And the promise, I mean, it is immense. Think about it. This stuff can scale in a way a human therapist never could, reaching millions of people. It's accessible to pretty much anyone with a phone, it can be hyper-personalized just for you, and, this is a big one, it gives you and your doctor actual concrete data to see if it's working. That's a massive leap forward from just trying to remember how you felt 3 weeks ago.
But, yeah, what's the catch? And that's a really important question because the challenges here are every bit as big as the promises. Let's run through the reality check here. First, data security. We are talking about some of the most sensitive data you can imagine. Keeping that safe is non-negotiable. Second, cost. Don't let the word app fool you into thinking this is cheap. The development, the clinical trials, it can cost hundreds of millions, just like developing a new drug. Then you've got algorithmic bias. What if the AI is biased against certain groups of people? And what about the digital divide? This could leave older folks or people who aren't tech-savvy completely out of the loop. And maybe the biggest question of all, liability. If an algorithm makes a mistake and someone gets hurt, who's to blame? The company that made it? The doctor who prescribed it? These are huge, thorny questions with no easy answers. But even with all those hurdles, the momentum here is just, it's undeniable. So let's look ahead. Where is this train going? Right now, North America might be the biggest market, but all the data shows the fastest growth is actually happening in the Asia-Pacific region. You see countries like Japan, China, and South Korea just jumping on these technologies, thanks to having so many smartphones and a lot of government support. This isn't just a Western thing, it's absolutely a global phenomenon. And the field is just packed with innovators. You've got the specialized pioneers, companies like Therapeutics, but you've also got the huge established health tech giants getting in on the action. And all that competition, it's just pushing the innovation forward at a blistering pace. You know, this quote really nails it. The idea of software becoming a part of our personal health, it's not a question of if anywhere, it's inevitable. The real conversation, the one we're having right now, is how. How do we do this safely? How do we do it ethically? How do we make sure it actually works for everyone? And that brings us right back to where we started. As this technology gets woven deeper and deeper into our healthcare system, that line between the pharmacy and the app store, it's going to get really blurry. Which leaves us with one final big question. Are we ready for it?